Hi, my name is Courtney Graff, and I'm a student nurse at Cedar Crest College. For my evidence-based practice research, I studied the effects of oral hygiene practices to decrease the risk of obtaining ventilator-associated pneumonia, or VAP for short. I chose this topic because there is a high incidence of mechanically ventilated patients obtaining ventilator-associated pneumonia. So my clinical question that I asked was, in critically ill patients, does daily oral hygiene practices as compared to usual care decrease the risk of obtaining VAP? To help explain the research that I conducted, I am going to refer to this poster that you see next to me. For my research, I found that VAP is one of the most common infections in patients receiving mechanical ventilation. It occurs in approximately 9 to 28% of these patients, with a mortality rate ranging from 24 to 50%. VAP is also directly linked to increased healthcare costs, high morbidity and mortality rates, and longer hospital stays. These statistics are significant and impact the nursing profession. This is because VAP is directly related to the colonization of respiratory pathogens in the oral cavity that are aspirated and as a result in the patient obtaining pneumonia. Oral hygiene practices are a nursing intervention that can be implemented by critical care nurses to help prevent this incidence of VAP in patients receiving mechanical ventilation. Therefore, nurses must adopt evidence-based practices into the daily care of these patients in order to decrease this risk. For my literature search, the databases that I used were PubMed, which yielded 254 initial results, which was narrowed down to 30, and PubMed Central, which yielded 172 results, which was narrowed down to 36. The keywords that I used for my search were critical care, oral hygiene, preventing ventilator-associated pneumonia, and intubated patients. Limitations for my search were articles that were published in English from 2006 to 2014 and free full text in peer-reviewed journals. The three studies that I used in my research were by Berry, Davidson, Masters, and Rolls in 2007, Fider, Mitchell, and Bridges in 2010, and Murrow, Grapp, Jones, McClish, and Sessler in 2009. The study conducted by Berry et al. Was a systematic literature review that worked to appraise peer-review literature to determine the best evidence for providing oral care to intensive care patients receiving mechanical ventilation. The results of the study concluded that due to the small number of randomized controlled trials and the variations of methods used within each trial, that a meta-analysis could not be synthesized, limiting the development of evidence-based guidelines. However, it did find that the use of chlorhexidine solutions is the recommended practice and that there is no significant evidence to support the use of sodium bicarbonate or hydrogen peroxide. The next study by Fider et al. In 2010 was a descriptive cross-sectional study, and the purpose of the study was to describe oral care practices performed by nurses for orally intubated patients and to compare them to current recommendations. This study found that most respondents did not know their institution's incidence rates of patients who obtained ventilator-associated pneumonia. However, from the study, nurses rated oral care as a high priority, with the most common frequency for assessing the oral cavity being performed every 4 hours. It also found that the use of chlorhexidine solution and toothbrushing were among the most commonly used practices. The third study by Monroe et al. In 2009 was a randomized controlled trial with a 2x2 factorial design. The purpose of the study was to examine the effects of mechanical, pharmacological, and a combination of oral care practices on the development of VAP. The results of the study showed that the interaction of toothbrushing and chlorhexidine were not significant when providing oral care. However, the study did find that the group of patients that received chlorhexidine alone had significantly fewer patients developing pneumonia, while toothbrushing was not associated with lower VAP rates. Therefore, chlorhexidine oral swabbing was effective in reducing early VAP. Since there are no evidence-based guidelines to support hygiene practices to decrease the risk of obtaining VAP, recommendations have been made. Efforts to prevent complications in mechanically ventilated patients needs to be started at the time of intubation. There also needs to be more well-designed, randomized, controlled trials performed to establish evidence-based practice regarding this topic. Berry et al. Also recommended looking at the nurses' perceptions on the importance of performing oral hygiene to these patients in order to increase effort among nurses to provide the proper oral hygiene to the patients. Further research also needs to be done to establish the best frequency and duration of the oral hygiene practices, along with an evidence-based standard for oral cavity assessments to reduce the risk of obtaining VAP. In conclusion, oral hygiene practices can be used by nurses to decrease the risk of obtaining VAP. Current recommendations for oral care practices include the use of chlorhexidine solutions. However, there are no evidence-based guidelines established regarding best oral hygiene practice in this patient population. Therefore, further research needs to be conducted regarding this topic. That concludes my presentation. I hope you enjoyed it.